People are driving 5 hours for dental implants. Here's why.
The number one thing that I talk to my patients about is if you can't trust us, don't go with us. At the end of the day, the people you choose and partner with are going to be there for life with you. We call it a dental marriage. Patients who come in from far and wide, sometimes 4 to 5 hours, choose us for that one reason, which is trust. We are a non-judgment practice. We believe that everybody should get that opportunity to get the best possible. Honest, upfront, genuine care is the reason people travel far and wide to seek treatment and healthy smiles.
I love doing dental implants because literally it changed their life. Having an implant is like a natural tooth. It's permanently there. Before that, they can't smile, they are embarrassed to talk, they are having a lot of infection in their mouth. Now they can be healthy, I can help them to chew better. They can live again, I guess, they can smile, they can do life with their teeth. Their appearance is going to be so drastically changed that emotionally and mentally, they will feel a lot better from the inside out.
How can all-on-X dental implants change your life?
Once you have this treatment, you'll be chewing better and most importantly, smile and gain their confidence back. We had this couple come and see us a few months ago. All they wanted was a smile that they could get out there and live life confidently with. The smile on her face when she got her first set of teeth was absolutely brilliant. Two hardworking people put their trust in our hands. And that's a huge responsibility for us. When they finished the entire process, both of them looked at us and said, "You actually don't know what you're missing out on."
Why are people choosing dental implants over dentures, even with the cost?
Really, this is for your great-grandmother. Dentures, for example, are nothing but a set of plastic teeth that sits at the top of your mouth and depends on suction to hold itself in there. Most people who wear dentures, especially bottom ones, will tell you that they move around all the time with the tongue, it's very hard to eat with, and they can barely taste their food. There is a better option. Dental implants provide the best stability for a set of teeth, all done when you sleep and then delivered to you in a day.
I grabbed a handful of granola just to eat in the car. Took one bite on the first piece of granola and I thought I'd dislodged my crown. I had to find a dentist who did some x-rays and turned around and said, "Unfortunately, you haven't just dislodged your crown, you've cracked your whole tooth and we won't be able to save it." When I was young, I had a dentist that said, "If in doubt, pull it out." I didn't want to go toothless. I was always terrified of having dentures. I certainly wouldn't have left the house. I would have been very, very conscious of not having a tooth at the front. That's how I found you, because I knew that one, I would never be able to tolerate dentures, and two, I'd probably need sleep dentistry. I retired 12 months ago. You helped me save my smile. I found it very easy, very quick, pain-free, very safe and very comfortable. Everybody makes you calm and relaxed and helps you right through it from start to finish. I had nothing. I didn't take any painkillers, had no pain whatsoever. I can't fault it at all. Don't put it off. The sooner you can get it done, the better, and once it's all over and done with, you can smile.
Broken or missing teeth? Here's what you can do.
If you are missing teeth, you have three options. Option number one, do nothing. Eventually, you'll end up with a lot of medical health issues. Option number two would be to get dentures, or what we call as plastic choppers. These have to be taken out after meals, cleaned with soap and water. It will affect your speech as well as the ability to taste and chew food. And the third option is what we call as dental implants. Dental implants provide the best stability for a set of teeth that will help you chew your food with confidence, eat whatever you like, whenever you like, and give you the lifestyle you deserve.
Hey hate my dentures. They hurt, they move, and I can't eat properly. Is there something better?
In today's world, with all this technology, innovation, and what we provide to our patients, do we really need to suffer with something like this? There is a better option, and that option is where we call all on X, which is X number of implants, fixed teeth in the mouth. Dental implants will help you chew your food with confidence, eat whatever you like, wherever you like, without the need to run to the bathroom to rinse your mouth and clean them. This is the beauty of dental implants.
I remember as a child where I could feel all the drilling, the sounds were horrible. You could feel it without the anesthetic. So I'm Ved Berani, I'm the general manager at Healthy Smiles. We've made a huge difference for a lot of anxious and phobic patients in terms of noise cancelling headphones for patients who don't like the sound of the drills and things like that. We also have blankets to make the experience a bit more comfortable. It's very personable. Even though we see about 80-90 patients a day, we don't treat people like a number. Healthy Smiles is a family outside my family, and now we've got 3 generations of patients. It's so lovely to see all those children that have grown up and are probably now parents. So it's lovely to see 3 generations of patients walk through the doors.
Ever heard of brand new teeth in a day?
We call them teeth in a day. Dental implants provide the best stability for a set of teeth, all done when you sleep and then delivered to you in a day. With a titanium bar and teeth made of ceramic, they are long lasting. You can eat whatever you like, whenever you like, including nuts, hard biscuits, toasties, as well as steak. This is the beauty of dental implants.
I think dental phobia is probably very common, extremely common. For me it was a dentist when I was a child, and I have let my teeth get to the point where they're falling out before I'd go to the dentist. But sleep dentistry would make all of those issues go away. I'm 68, I don't want the rest of my life, be it 5 years, 10 years, not be able to have a piece of steak. I love the idea of sleep dentistry, and if I'd had that option years ago, I'd been going with it. It's the best nap you could have. On that very first visit, you gave me confidence, you were confident from the moment you come in the door here. It's comfortable, it's happy, everyone's got a smile. Afterwards, no pain, it didn't hurt, I was barely bruised, I was hardly swollen, and then I came back the next day and you put my teeth in. I couldn't believe it, could not believe it. Everyone notices, everyone comments. People notice that I'm happier. My life is easier. I'm very much looking forward to living a normal life again. I've recommended you to everyone I know. You are the dentist that I'm going to stick with until I don't need a dentist anymore. I can't imagine going to a different dentist.
Why are so many people ditching dentures for all-on-X dental implants?
Dentures, for example, are nothing but a set of plastic teeth that sits in the top of your mouth and depends on suction to hold itself in there. Most people who wear dentures, especially bottom ones, will tell you that they move around all the time with the tongue, it's very hard to eat with, and they can barely taste their food. Adhesive called polydent to stick it into the mouth, and that itself leaves a dirty taste in their mouth all the time. In today's world, with all this technology, innovation, there is a better option. Dental implants provide the best stability for a set of teeth, all done when you sleep and then delivered to you in a day.
How much do dental implants cost in Melbourne? Are there payment plans or is it all upfront?
Dental implants are not cheap. And that's why it's really important you do your research before choosing your dental provider, and you would choose them based on 3 main reasons. 1. Dental experience. Do they know what they're doing? All-on-X dental implants with 4 to 6 implants starts at roughly about $25,000. For a single tooth, dental implants can cost $4,500 up to $8,500. For as little as $42 a week, you can actually pay off the cost of a single dental implant. This can be arranged by our experienced treatment coordinators here at Healthy Smiles.
Are dental implants painful? Here's what most patients actually feel.
One of the most common myths about dental implants is that it's painful. Most patients who have dental implants with us tell us they had pretty much no pain the next day. All they had to take was a couple of Panadols. There are a few reasons for that. 1. Experience of the operator. 2. We have a process by which we place the implant gently in the right area so there's minimal discomfort. And number 3, we know exactly what medications to give our patients so that they have minimal pain after, minimal discomfort, and get back on their feet and back to their jobs. Initially, when I saw patients, they came in with a lot of problems. Broken teeth, missing teeth, cavities, root canals. All their stories were very identical. A huge issue these patients had was phobia and anxiety. It wasn't about money, it was about, can I really go through a process of 10, 15, 20 appointments when I actually hate coming to the dentist? And that's how sleep dentistry was born. We initially started with intravenous sedation, but soon realized we needed longer appointment times and we needed qualified anesthetists to help us out. That's what established Sleep Dream Smile as a center for dental implants, large dentistry, as well as sleep dentistry. The tears we get, the hugs we get, they are just absolutely, like, you can't put a price on something like that. The best fees I could ever get is when the patient holds my hand or gives me a hug and tells me, thank you, this changed my life and this is gonna change everything I do from this point forward.
Can I use my superannuation to pay for dental implants?
Most patients pay for dental implants with payment plans, which we can arrange in-house, or an alternative is what we call early release super. Early release super is a process where patients access their own super to pay for their dental implants and an all-on-X procedure. Whatever options you choose, we are here to support you because we believe our patients should get the treatment they deserve after knowing all the options.
Dentures is like wearing thongs. It's not easy to be retained in your mouth. Like, it sometimes become loose. Sometimes I see patients with ill-fitting denture. They actually flop out when they speak or when they eat. They can't smile. They are embarrassed to talk. They are having a lot of infection in their mouth. I love doing dental implants because there are more fixed options, more permanent solution than dentures. Having an implant is like a natural tooth. It's permanently there.
What if you could fix all of your dental problems while you sleep?
Many years ago, we found that there was a crucial need for people who are anxious and phobic about their dental problems. This was one of the main reasons they avoided going to the dentist. Sleep dentistry is actually a sleep dentistry. A sleep being you have a general anesthetic and get over all your dental problems in one single go.
I should have done something sooner. I put myself in a position that I actually now deeply regret. I'll be honest, I'm petrified of dentists. I knew it was something serious. I had a couple of loose teeth. I'm too young to have dentures. My grandparents had dentures and didn't want to go down that path. I came to Dr. Ved, read quite a few Google reviews. There are other options around, but the reviews made the choice actually pretty simple. I had to bite the bullet and do something about it. My name's David Brown. I saw the sleep dentistry and that's what got me in here. Going down the path of implants was actually an easy decision for me. Was I petrified? Absolutely, but it was just that total sense of ease and comfort and really friendly and approachable staff. They know my name at the front desk now, ask me how I'm going, have a chat. I think I'm part of the furniture now. The thing that really surprised me, and it's one of the things that still surprises me, was next day coming in for a post-surgery checkup, and there's my temporary set of teeth, and I was like, I didn't expect that. I was actually surprised how little swelling there was. Pleasantly surprised how quick, how painless. I actually don't fear coming to the dentist anymore. Just the confidence, it is the best investment that I've made in myself. It was a no-brainer.
What dental treatments can be done under sleep dentistry?
All sorts of procedures can be done under sleep dentistry. These include minor dental procedures such as fillings, cleans, deep cleaning, as well as simple extractions, right up to complex procedures such as dental implants, crowns, bridges, and complex surgical extraction such as wisdom teeth.
Who benefits from sleep dentistry the most?
The patients that benefit the most from sleep dentistry are the ones who are anxious, phobic, and haven't been to a dentist for a very long time. Most often, these patients, they really don't know what to expect and have the fear of the unknown. So when these patients come and see us for our first consultation, we do a thorough examination, x-rays, photographs, and then give them a comprehensive treatment plan, which then the patient can plan to do it in one go.
Haven't seen a dentist in years due to fear and anxiety?
The patients that benefit the most from sleep dentistry are the ones who are anxious, phobic, and haven't been to a dentist for a very long time. Most often, these patients, they really don't know what to expect and have the fear of the unknown. So when these patients come and see us for our first consultation, we do a thorough examination, x-rays, photographs, and then give them a comprehensive treatment plan, which then the patient can plan to do it in one go.
Sleep Dream Smile started over 5 years ago now. It's a great option for people who are very anxious about dental treatment, or it's going to be a really long appointment and they don't want to be awake getting that done. We have an amazing team that come in and work with us as the anaesthetic team, an anaesthetist, a registered nurse, and then our dental treatment team. This is our recovery area in here. Once your dental treatment has finished, you'll spend some time in here until you've woken up enough and you're medically fit enough to be able to go home with your loved one. We actually have a lot of people that come to us who haven't been to the dentist for many years. They may have had a bad experience as a young child. They may have heard of their parents' fears and they've taken that on. There's many different reasons why people haven't been to the dentist. When you do make that appointment, we're here to support you through that. We also understand that after some people have heard about us, it can take a little bit of time to book that first appointment. What we say to you is come and see us. We don't have to do any dental treatment on the day. We can do a free consultation for you so that you can discuss what your concerns are, and we're going to see what we can put in place to overcome those for your future.
All right. Hello, good afternoon. This is the final day of this journey, and hopefully from here it's just, maintenance every 3 months, coming in, seeing the hygienist. 3 months first and then 6 monthly after. Okay. Right? So it don't have to be every 3 months. The cleaning routines, the usual, the water pick at home, stuff like that.
Yeah.
But we just want to do this interview to get an idea of, both of you came in first time to the practice. Why did you choose this practice?
I found you on Facebook, and when I rang the lady, she was the nicest one who explained everything to me. And I told her our fears that were petrified of dentists and we'd kill them if they hurt us. And she was the one who convinced me. So, and she said she'd give me the nicest dentist in the practice, which was you.
What was her name?
Can't remember. I've got her in my phone somewhere, I think. And yeah, I made an appointment and then we got to see you.
So after the first consult, obviously there was a lot to talk about,
Yep.
and there was a lot happening. And I know, Scott also had this anxiety around going back and getting things fixed. So what was it about after you met us that made you trust us and believe that this is the place we're going to do it?
Because you didn't push us. You told us what our options were, but you didn't.
And you told me I had to do it.
You didn't. You didn't push us. You explained everything thoroughly, and it made us feel at ease, and we felt like we could trust you. So, and you never let us down, ever.
What is sleep dentistry like? Because I mean, obviously, to do all that within 5 to 6 hours is a big thing.
That was good. Yeah.
Yeah.
Just fall asleep and have it done. Waking up wasn't so bad.
No. I've recommended you to everybody I know who's petrified of dentists and want to go to sleep. Great nurses, great staff. Everybody helped. There wasn't one person that wasn't family orientated.
Yeah, it's all friendly. Yeah. Reassuringly friendly. Yeah.
Thank you. So if for example, sorry, my other question was around the actual well, actually you said that already. I normally ask would you recommend us to your family and friends, and you answered that
Been doing
already.
it a lot.
Before I even had the teeth done, I was giving your number out because there's a guy at work who wants to have something similar done to what we've done, and he's petrified. And I
And
said,
Amanda's friend.
and Amanda's friend, which, Dylan, he's lost his 2 front teeth. We said we'd even come with him. So
Because he's just as scared as we
Is
were. Yeah.
you just make everybody feel comfortable. Yes, we still don't like dentist chairs, but we like the dentist.
Appreciate that. Thank you very much.
You're welcome.
Yeah, that was really nice.
And that's the truth. We go around Australia. I wish I could come. I think I'll still come back every year to get my teeth cleaned by you because I feel safer.
You just realign dentist visit with coming down to see
Yeah.
the kids.
You haven't taken my fear away, but you've made it a little bit more comfortable. You used to like them.
Oh, I'm still scared shitless. I am.
Yeah.
But it's a lot better than it was.
And you've given us something we never thought we could have. Teeth.
Should keep us a bit healthier too.
Yeah.
Absolutely.
We've noticed that already, haven't we? We're a lot healthier, a lot happier. And soon we'll be able to eat steak.
Wait for that one.
In a week.
In a week.
Yeah.
So, just nice broad smiles for the ending and a nice kiss, which is
Used
you
to
guys
do
do
that.
really
Thank
well.
you.
No, each other.
Ah, all right.
Well done. Thank you.
No, because seriously, it's the truth. And I have given your number
Yeah.
out to quite a few people, so you might have a few knock-ins. And I asked to see you, no one else.
Thank you. Alrighty, we'll see you next.
Oh my God. I have teeth.
Yeah, you do. Nice white ones.
They're really good. Do they look good?
Yeah, they look great.
And I don't have to gag on them ever again. I'll take them out anymore.
She's gonna make me cry now. No, she wants that. They do look
Thank
amazing.
you. Yes.
Yep. Yep. Gentle one.
Yeah. What wife puts her husband through this? A nasty one.
Oh no, it's all good. Fair's fair.
At least you just swallowed his
My teeth were just basically killing me. It felt like my mouth was just horrible. I was so scared, so terrified, and so embarrassed. I was really, really embarrassed. So coming here, I knew I'd be in safe hands. I always felt supported by everybody. And I knew I had to do something, otherwise I was willing to get the teeth pulled out because I was just so desperate to stop the pain, to stop everything just hurting. So learning that, you had an option of putting me to sleep was even better because of the previous trauma. So yeah, it was best decision ever. Even though I was scared, I was still being heard because it's the biggest thing I've ever done, and it's the most expensive thing I've ever done. I mean, it's something that I can do lightly, and I knew I couldn't get it done awake. I just couldn't. So it was just knowing that I wouldn't have to revisit any past, anything, just go to sleep, wake up. I could deal with the pain. I deal with pain all the time, but I could deal with all that side of it. It's just those memories. I just didn't want any of that. I'm learning to be confident again because a lot of my confidence went. I would speak like that and I would not open my mouth. And I'm still learning that it's okay to open my mouth, and I'm not going to scare people anymore. Supercare involved, and they were amazing. They were really good, the third-party people. They were really good and sorted everything out for me as well. I could have done it myself, but I already was overthinking everything anyway. So just to go, right, here you go. Can you sort that out for me? And they did. They were great. They were really good. I wasn't going to wait till I retired. I haven't even started working properly yet because of this. So do you know what I mean? It's like, yeah, I needed it. Yeah. Because of the care factor. Like, you obviously care about people. You understand that this isn't easy for anybody. Like, it's not cheap. It's not. People. It affects everything. It affects not only your eating, your swallowing, your whole mindset. Having dodgy teeth can really affect you psychologically. And then all my teeth were just basically killing me. It felt like my mouth was just horrible. So I think I would have found you anyway, but I'm really glad I did because I was so scared, so terrified, and so embarrassed. I was really, really embarrassed. And yeah, so coming here, I knew I'd be in safe hands. I always felt supported by everybody. And I knew I had to do something, otherwise I was willing to get my teeth pulled out because I was just so desperate to stop the pain, to stop everything just hurting. So learning that, you had an option of putting me to sleep was even better because of the previous trauma. So yeah, it was best decision ever. Yeah.
What was it about sleep dentistry that you liked the most? The experience in terms of going to sleep, then coming out, and then not remembering anything?
Yeah, I always felt supported. I felt listened to by you, by people at the desk, by you guys. You've been amazing. And I felt, even though I was scared, I was still being heard because it's the biggest thing I've ever done, and it's the most expensive thing I've ever done. I mean, it's something that I can do lightly, and I knew I couldn't get it done awake. I just couldn't. So it was just knowing that I wouldn't have to revisit any past, anything, just go to sleep, wake up. I could deal with the pain. I deal with pain all the time, but I could deal with all that side of it. It's just those memories. I just didn't want any of that. Yeah.
And how do you feel now about your smile? What was it?
I'm learning to be confident again because a lot of my confidence went. I would speak like that and I would not open my mouth. And I'm still learning that it's okay to open my mouth. And I'm not going to scare people anymore. You know, I couldn't go to work. Yeah.
All right. So, a little bit on the superannuation side
Yeah.
of things. I know that it was a battle and there's a lot of paperwork.
Yeah.
But a lot of the patients who come and see us here do exactly what you did, which is they have to dig into their own savings to pay for major work like you've had done.
Yeah.
So, give us some positives around it in terms of the process and the help that the practice gave you, and how using your superannuation money will help you get over this sort of things.
No, absolutely. I ummed and ahed, and I thought, right, I'll download all the forms and I'll have a look and I'll see. And I thought, it should be easy enough. And then I went, no, it's not going to be enough to speaking to you. And the amount you've got to get the GP, you've got to get this to sign off and that to sign off, and it was too much. So getting Supercare involved, and they were amazing. They were really good, the third party people. They were really good, and sorted everything out for me as well. I could have done it myself, but I already was overthinking everything anyway. So just to go, right, here you go, can you sort that out for me? And they did. They were great. They were really good. And the options here, I mean, Zip Pay could have worked as well. I looked into that, but Super was easier.
And the fact that Super is your own money.
Yeah. Oh, yeah, for sure. And, you know, it's not like the old days where you needed to put a deposit on your house. I mean, you know, I don't have a lot of Super because I've lived overseas a lot. So, you know, but I needed it done. And nobody, it was a good choice to do it that way. I don't need it. Well, don't need it for anything else.
And the most important thing is the super money is there for when you need it.
Yes,
Whether
I
you're
didn't
50 or
even
70,
know that. Yeah, I did.
The fact that you needed it to fix your mouth so you can eat better, smile better, is in itself the whole reason you save up from when you're 20, right?
Yeah, absolutely. Yeah, I wasn't going to wait till I retired. I haven't even started working properly yet because of this. So, do you know what I mean? It's like, I needed it. Yeah.
It's about quality of life, isn't it?
Yeah, it is. It is. And whatever you've got, I mean, that's the whole thing, because with the other stuff that's going on, you know, I don't know how long. And I'd rather be able to look half decent rather than crumbly all the time. Yeah.
So, one last question.
Yes.
I know you have to go, but last one. If you had to refer a patient to the practice, would you, and why?
I would, absolutely. Yeah, I would. God, yeah, I would, absolutely. Because...
So if you say, I would refer a patient to the practice
I would refer, I would definitely refer, or I would definitely tell my own dentist, you know, prior to this to, you know, come and see you, or refer people to Too Hard, or got phobias or whatever, to come and see you guys, definitely. Because, can you swear on this? No. Because of the care factor. Like, you obviously care about people. You understand that this isn't easy for anybody. Like, it's not cheap. It's not. People, it affects everything. It affects not only your eating, your swallowing, your whole mindset. Having dodgy teeth can really affect you psychologically.
Thank you so much. I appreciate it. That was honest, a heart.
You
know, I'm getting these pimples just listening to you. But it's do you want to just tell us your name and when you came to the practice, what were your main concerns at that time?
I'm Jeff Hicks. I come to the practice 5 months ago, whatever it was, because I couldn't eat properly, and I heard about you lot, and so I thought, give it a try. And it's been real good.
So, how was your experience with the super application, with Anne assisting you, and then obviously it was complicated, but how did you feel about how we helped you out with this entire process?
Oh well, yeah, originally they screwed me around.
So you can just start with with the super application.
Oh, yeah.
It was, yeah.
With the super application, they stuffed me around a little bit. You guys helped me out, and perfect. No dramas after that, but up until then, they were trying not to pay.
Yeah, but so in terms of the actual sleep dentistry, how was that whole surgery? Because you were obviously, there's a lot of phobia and anxiety about the dental work, and then how we took you through it. How did you feel about that?
Well, the surgery, as far as that went, I was nervous when I first started, but after chatting to you and everybody else, it was breeze. There was no stress, no drama, nothing was a problem, so they're all good.
Okay. So how do you like your new smile? And so I'll just tell you how you feel about living life now, what your plans are, and then give us a broad smile in the end, all right?
The whole getting the new teeth out was good, because up until then I wasn't confident going out, but the main thing was not being able to eat the foods I like. Now after they're done, I can eat perfect, everything's fine, and yeah, healthy smiles have been really good. So yeah.
Start. We did it!
We did it. All right. Well, thank you very much for helping us out with this. We just want to know your story. How did you find us? Why did you choose us? And I know you've had Kay and me both take care of you. So let's just start with that a little bit here.
Sure. So initially I came to see Kay because I was really worried that I was...
The camera moves with you.
No touching the table.
No touching the table.
Okay, all right, I'll start the story again.
That's it, I'll hold it down.
That's all right, I cannot touch the table. I can do this.
I'll pull this table away.
Okay.
So I first came to see Kay because I was really worried that I was actually going to bite through my front teeth. After a couple of decades of intense grinding, I'm a very skilled grinder, and a slightly off bite, my teeth had become very thin and were at risk of breaking. And so I began a process to fix that and end up with the teeth I have today. I started off with Invisalign, which took, I think in the end it was about 9 months. It was going to take between 6 to 12 months, and it was really about 9, which was about realigning my jaw so that my bite would work properly. And then after that, we have put in 6 crowns, and it's really changed the way my teeth feel and look, and I'm really pleased with the result. I think it looks pretty excellent. Do you want me to? I can add more, but that's the summary of the story.
So what are the key points in saying, okay, this is the dental practice, I'm going to stay here?
So I actually originally found the dental practice because my daughter is neurodiverse, and I knew that she could potentially have a really significant challenge with dental work. She'd been avoiding the dentist for about 6 years at the point we came in, and the fact that there was an option of sleep dentistry really meant a lot, and she has subsequently actually taken advantage of that sleep dentistry option. but then after she came, it just made sense that I would too. Kay was just wonderful. Like, we've had a really great experience with Kay. I did shop around for quotes, to be honest. So after I got the initial quote on the Invisalign and the crowns, I got some competitive quotes, and the pricing actually was really competitive. Somebody proposed another solution which basically involved putting crowns on every single one of my teeth, but you probably don't need that bit of the story. But it seemed like a really sensible solution. It seemed like a long-term solution, and it was a competitive quote.
Okay, great. So from the experience and the people here, do you have any comments around how we approach people, how we talk, how we manage them?
I really love the whole team. Sky and Megan at the front desk, and Anne. I've spoken to all of them, and they're always really helpful. Anne, Sky and Megan, I've spoken to all of the team on the front desk, I think, and they've always been incredibly helpful. They've been really generous in helping me sort out whether it's payment issues or, you know, trying to shuffle around appointments. And between my daughter and myself, I think we've seen 5 of the dentists, and everybody has been really amazing. And my daughter didn't take to one of the dentists, which was nothing about them. I thought they were lovely, but she just wasn't comfortable. And there was absolutely no dramas in working to find her a dentist she'd feel comfortable with. Like, everybody has been extraordinarily nice.
Do you have any words for Dr. Ved?
For Dr. Ved, I would like to say thank you very much. Not only have you given me great teeth, but you've been so kind and generous, and I really appreciate your approach and your flexibility. That's been pretty amazing too.
Thank you. So if you had to recommend any of your friends and family here, what would you say to them?
So I have recommended that friends and family come here. I don't know if any of them have. I would say to any friends and family that it's absolutely worth checking out the practice and to consider getting their dental work done here.
Thank you. Amazing. That's all?
Yeah?
Nice and easy.
Nothing else you wanted to cover?
Bit more. There you go.
Oh, that's good, because I wanted to see the top.
Yeah.
Yeah.
You happy?
Yeah. Yeah, no, that's good. Yeah.
Holy shit. They're very wide. I don't know, you can cut that down. Where's my husband?
Amazing. Look at that. Look at the amount of lip support we got. Because you got a short upper lip. Now you can see you had. I'll show you the photo I took before. You had a dip. You had like this.
She's lucky because she's got
Inverted. So you're telling me about that date with your new smile. Where are you gonna go with your brand new smile today?
Work.
Give us a bit of feedback on how it went with the whole thing, and
Yeah, look, it was a good process. Very worthwhile. I feel like a different person.
Wonderful. No, just look at me.
Okay.
Yeah, but we're gonna do this side video. All right. Hello, Michelle. Welcome to Healthy Smiles.
Hi,
How was
thank
your
you.
experience here?
Fantastic. I love my teeth, and it was easy and non-scary, which I was a bit worried about at the start, but it was really good. It was perfect.
Fantastic. So, what do you like about the sleep dentistry side of things?
Less pain, no pain and no fear, because I get anxiety. So it's no fear, no anxiety. Just to know that you go to sleep, you wake up, and it's done, and that's perfect.
Would you recommend us to your friends and family?
Definitely, yes, definitely.
Why?
Because the end result and the whole process has been easy and relaxing, and it's friendly. It feels comfortable. So all the staff and everyone's comfortable.
Thank you. Done.
Yeah, it looks fantastic.
Good as well.
This is all your
Keep
smile.
smiling.
Oh, this is all your smile design.
That's a good job. One more. That's it. Are you ready?
She's always ready.
Oh my god! Oh baby! Oh, it's gonna get nasty in the room. Do they suit me?
I'm going to put protection on my nipples now. They suit you, baby.
Oh, you did amazing. Huh?
That's beautiful, eh?
Yeah. Yeah. What do you think?
Punta. Ella. Χαμογέλα.
Ωραία. Και δεν κουνιούνται καθόλου,
Όχι.
Ωραία.
Ωραία είναι.
Okay.
So she doesn't have to take them out, nothing?
Nothing, yeah.
They'll tell you what to do.
Ωραία είναι, mum. They look very nice.
Απίθανα. Τρομερά. Thank you, doctor. Thank you, George.
It's all right. Αυτή είναι μόνο η αρχή. Έχουμε ακόμα να κάνουμε.
Τα κάτω.
Smile. You gotta smile wide. Smile. That's good.
Okay, cool.
We should.
Big cuddle. I'm gonna cry. I'm so excited for her. Yay! Okay, I am gonna cry. Beautiful,
Thank you,
mum.
doctor.
So nice.
This. Okay. Yep. So, firstly, thank you for thank you for choosing us. We really appreciate the trust you placed in us. We are so thankful for that, because that gives us an opportunity to serve. And, you know, it's not an easy thing for when your journey started.
Yeah.
Do you want to tell me how and why you decided to go with us?
Instinct, gut feeling. I don't know, I just kind of knew this was where I was meant to be. So I came and met you to check it out, and it was you two I met, and I knew then, okay, I'm in good hands. So I kept coming back.
Okay.
And it went much faster than I expected, which meant I had to trust a lot. And I did, and it was pretty much you two that I trusted, and I just, okay, here we go, take a leap of faith. I think I'll be okay here.
How's your experience with the sleep dentistry and the implants and, you know?
It's been amazing. I had no familiarity with sleep dentistry. I was excited to hear about that, but I don't need to be put to sleep to have work. I had a huge amount of fear because the amount of work that I needed was bigger than I could imagine. It was beyond my coping skills. And you made me feel like, no, we've got this. We've got you. You just turn up and we'll do what we know. And that gave me confidence to come back. So it's been good.
How does having the dental implants fixed in the jaw feel, as opposed to you would have probably ended up with full dentures, right, at the bottom? So
yeah.
Dental implants, why was that a choice?
The permanence of them, the not having to take teeth in and out, and the convenience, the ease of it, so that it's just, I've got new teeth. They look and feel good, they work. And before, they were spontaneously ejecting. I was losing teeth every few months. And I was getting more and more frightened because it was becoming more and more visible. So this is it was a big step, but the outcome's amazing. They're just there. I don't have to take them in and out. I don't have to do anything. They're just my new teeth.
Would you recommend Healthy Smiles, Dr. Ved, our team here, to your friends and family?
Absolutely, already have. Already have. I just think you've cared for me through the process. I felt cared for. It's also an incredibly professional setup. There's lots of people here all the time, so I get a sense of, oh well, lots of people keep coming back. That's a good thing. Yeah, I've already recommended you to others.
Thank you. Appreciate it. Thank you for the honest feedback. Is there anything we could do better?
At times I felt that I didn't really know what was happening, and there was probably a lack of clear information. I got lots of information, but there were still gaps in my head. Now maybe I didn't hear what you said because I got stuck on the first thing, because it's a lot of information. So I don't know whether I missed it or it didn't come, but because I ran on trust and faith, just let it go. You guys, it's your job. If you need a garden done, then you have to trust me.
Yeah.
But for my teeth, I have to trust you. It's your thing.
Right. Thank you. Appreciate it. Thank you. That's it. Easy.